We will also run a lipid panel. We do want to look at cholesterol markers, and that's something that can be important, especially when it comes to neuropathy. A lot of the people who come in here into my office with neuropathy problems, whether it's hands and or feet, they're on statin drugs, cholesterol lowering medications like Lipitor or Crestor or some Zimvastatin. And what these cholesterol drugs do, and I'm not going to tell you I'm taking off of those drugs, I'm not going to practice medicine without a license here, but I want you to understand, those cholesterol lowering medications actually stop fat absorption, cause a problem with fat absorption in your body, and your nerves, in order to function normally, normal neurological function, those nerves need to be coated with fatty substances. When you're taking statin drugs like Lipitor, it actually robs the body of absorbing certain fats that can cause a problem with the way that the nerve is firing its electrical impulses if it doesn't have the fat protecting the nerve cell. That's very important to understand. We can assess your thyroid, your adrenal glands, your liver, your kidneys, your red and white blood cells, your gut function with the above lab tests that I mentioned. All can be affected with your chronic health condition. And by addressing any and all of these problems, we've got to be able to understand, we've got to regulate glucose levels that are going into the bloodstream, because abnormal blood sugars can cause neuropathy. You don't even have to be a diabetic. You may be a pre-diabetic, and that can cause a problem. Let me help you understand something, and something that patients don't really get before I explain this topic, is there are lab values, for instance, with your blood sugars, as we show on the screen right now, glucose levels in your blood. When a doctor looks at your blood glucose level, according to the lab finding, he's looking at a lab value. And a lab value is how the lab gets, they take all the people that they've tested, people with diabetes, people with hypoglycemia, people with thyroid problems, people with AIDS, people with strokes, people with heart attacks, people who are obese, people who are anorexic, people with ADD, people who are triathletes, people who are bodybuilders, people on hormone replacement, people on thyroid replacement hormones, people who have cancer. They take all these people who are very healthy and very sick with different kinds of sicknesses and on different drugs and different medications, and they take all of their lab values, and there are millions of people who are getting their blood checked every week, every month, every year, and they pool those people together and they make a big bell curve. And that's how they create their low and high lab values. What we do that's different is we use lab ranges, not lab ranges, excuse me, we use functional ranges for blood chemistry analysis and for hormone and for immune system analysis. And these functional ranges are a much tighter gap. We don't look at a very large range, for instance, like with blood glucose, where they say the low is 65 and the high is 99. My range is much tighter, 85 to 99, because we understand that when somebody falls a little below 85, they may be showing signs of fatigue, of jitteriness, of anxiety. When somebody is above 99, even if they're below the diabetic number of 127, or some doctors say 126, actually I've heard some doctors saying 145 these days is the number for diabetes, which doesn't make sense, but that's what they do. If it goes above 99, your blood sugar, it shows that your body is too stressed, which stresses other organs and systems of your body. Remember I talked earlier about the neuroendocrine immune axis. Whenever the blood sugars get out of order, one of our priorities to look at is if this is even 104, 105, 109, 115 for glucose, there's too much stress on your system, and it causes a problem with the way the nerve in your body is able to absorb certain nutrients and get certain nutrients out. Okay, so that's very important. We've got to look at very tight functional ranges. Anything below 85 or below 84 for functional blood chemistry analysis, you're showing signs of reactive hypoglycemia, jitteriness. I feel like I'm tired all the time. I feel fatigued. Okay? Anything above 99, we're looking at insulin resistance. Insulin resistance or prediabetes means that those cells in your body are not able to utilize the insulin to start storing sugars for energy production later on, for brain function. You will understand that in just a moment. Our four priorities that we look are anemias. Anemias could be iron anemia. It could be a B12 anemia, a B6 anemia, or something even more involved called a pernicious anemia, where there's an autoimmune attack on your body. Iron and B12 and B6 will not even help that one. We're looking at, again, I said blood sugars. We're also looking at what's called the ASI test. ASI is adrenal function. We'll get into that in just a moment. We're looking at the gastrointestinal and liver function, and we're going to look at fatty acid malabsorption and or absorption. You can test the adrenal glands, something that's very important to understand. Our nervous system depends on our brain function that controls the feeling in our hands and our feet. Our brain depends on certain hormones, certain nutrients, blood sugars being normal, iron absorption to bring oxygen to the brain. There's a number of things that we can discuss in person. But we run a test called the adrenal stress index. And the adrenal stress index, we're able to actually check your adrenal gland. Your adrenal gland lets out a hormone. The hormone called cortisol. Cortisol is a hormone that actually finds sugar in the body and brings sugar up to your brain to allow your brain to eat. You see, your brain needs three things to survive. It needs stimulation. If you don't use it, you lose it. You've heard that before. It needs stimulation, it needs normal blood sugar levels, and it needs normal oxygen levels. We'll get into the oxygen in just a moment. But in order for the brain to get sugar, it needs the function of the adrenal gland. So we run a specific test called the adrenal stress index. There's a DNA test that we can do that will tell us, is the adrenal stressed or is it working properly? Now, somebody may say, I already know I have an adrenal problem. The test that we run doesn't just tell you that you have an adrenal problem. The test we run actually will tell us what stage of malfunction your adrenal gland is in. There are 7 different stages, from a high DHEA level to a malabsorption problem through your adrenal gland, to a non-adaptive problem where you can't adapt to the stresses in your life, to even an adrenal exhaustion or an adrenal failure. And that can happen for a number of things. That can happen because you're too stressed, because you drink too much coffee, because your blood sugars are not normal. That can happen because you're on hormone replacement therapy. These can all stress the adrenal gland. And when the adrenal gland, which is right above your kidney on the right and left kidney, when the adrenal gland is stressed, you can't get the normal hormone production out of that adrenal gland to help get the brain to get its nutrients that it needs. It's so important, this test. And anybody who's suffering from insomnia, anybody who's suffering from diabetes, anybody from any condition really, but insomnia patients, the adrenal stress index is a must. You will never understand why you can't sleep until you really finally check that adrenal test. Something else that we've got to really discuss here when it comes to neuropathy, as well as a lot of other chronic conditions, is your immune system.